Thank you. You and your family may want to get away for a little summer vacay, but is that safe during the coronavirus pandemic?
Let's talk to our health reporter, Haley Hernandez, live this morning. What's the news, Haley?
Hey, good morning, guys. So the CDC is not advising you to cancel any summer travel plans. However, I spoke with a doctor in Katy about which types of travel can actually be more dangerous for infections. The CDC's updated practical advice for using public transportation, ride shares, and air travel was consistent with other advice on preventing infection. Wash your hands and be careful what you touch. To improve air circulation, open windows, especially in cars. Infectious disease Dr. Linda Yancey from Memorial Hermann in Katy says air travel has more risks, but spacing rows between your family and others could help.
The way air circulation on airplane works is you are sharing air with the people to either side of you and the people on the other side of the aisle with you, and a couple of rows backwards and forwards. The air circulation goes around, not up and down the plane. So I know a lot of airlines are trying to distance people in alternate rows. That's actually a really good way of isolating people in pockets of airflow.
When traveling by air, bus, car, or train, limit touching these surfaces. Kiosks, touch screens, and fingerprint scanners, ticket machines, turnstiles, handrails, restroom surfaces, elevator buttons, and benches as much as possible. If you have to, wash your hands or use sanitizer after you touch them. Dr. Yancey says there's also increasing proof that masks will keep you safer.
Wear a mask or a face covering. That is very important for protecting the people around you. Cloth face coverings work just fine. Just make sure you've got at least 2 layers of cloth.
And consider traveling during non-peak hours when there are likely fewer people. And the CDC is saying to please respect social distancing guidelines that are put out there by the transit authorities. You know, you'll see floor decals or signs indicating how you can stand 6 feet apart. Dr. Yancey says just get used to it. This is going to be the norm for several months. She knows that it's not feasible to avoid traveling. So just make it a priority to keep you and the other people around you healthy by maintaining that social distance. Guys?
Something we always have to remember, right, in these times. Haley, thank you very much.